Hi guys, Dr. Gary here. So this is a showcase video on a patient of mine who had a surgical hairline advancement surgery. And I wanted to share her story with you and really talk about the procedure in detail. Okay, I want you to understand what this procedure can do, what it can't do, and also really the nitty-gritty. Surgical hairline advancement, I'll be referring to it as SHA. That's the abbreviation we use. Keep in mind the uncensored footage is up in our Patreon. Okay, so there's a link to that in the description below if you want to check out all the actual surgical stuff, like the bloody, footage. We really, even though we can put it up on YouTube, our videos get heavily demoted and they don't end up propagating on YouTube. So we have chosen to do it this way. So if you want to see the technical stuff, at least from the visual perspective, make sure to go on Patreon. If you're okay with just the descriptions and seeing some stuff, at least the markings and things like that, feel free to watch this video and enjoy it. At the end, we'll show you how she's looking at 1 week, and this patient's been super happy. So a little bit of background on her: 44-year-old woman with a congenitally high hairline. So she was born this way. It was not a situation where her hairline was here and then it receded up over time. You have to be careful with those patients. You don't want to necessarily do a surgical hairline advancement because then they get a scar here. If their hairline keeps moving back, they could be in trouble. So we discussed a surgical hairline advancement versus a hair transplant. And this patient in particular just favored a surgical hairline advancement, which I think was very appropriate for her. And what I explain to patients is that I can lower your hairline in most cases by about 2 centimeters. Sometimes a little less, sometimes a little bit more, but I don't like to overpromise when it comes to the degree of lowering because I think people can be disappointed. And if you really pull that scalp and lower it by more than how much it wants to be lowered, you can stretch out the scar. So now you've gotten the hairline to here, but now your scar has widened because of all that tension, and now you have a centimeter worth of white scar. So you probably don't want that. And so I tell people, look, if you're not going to be happy with 2 centimeters, then don't do the surgery. We also discussed with this patient the potential need for a hair transplant in the future to address the temples and the scar. So sometimes we'll do a hair transplant into the scar from the SHA and into the temples to kind of round things out. So now in terms of a surgical hairline advancement versus a hair transplant for hairline lowering, we have an entire video on that subject. Just to summarize, SHA is good for more instant results, and if you really care about the density, if you want a more instant result and you want it to be really dense, then SHA makes sense. Hair transplant is better if you're trying to customize the lateral aspects, if you're trying to promote the lateral rounding, for example, and if that's the primary thing that bothers somebody, then it doesn't make sense to do the SHA. Better off just doing the hair transplant. You get no frontal scalp scarring with the hair transplant, and you can do the hair transplant awake, whereas for the surgical hairline advancement, I prefer at least IV sedation for those patients in the operating room with an anesthesiologist. That's very different from our hair transplant. So please make sure to subscribe to our channel if you haven't subscribed already. We do a lot of this type of showcase work where we're just giving you the honest kind of play-by-play of the surgeries. We do a lot of reaction videos and we do a lot of celebrity review videos, and then just some other types of educational content related to hair transplants and facial plastic surgery. So preoperatively, the patient was told not to eat or drink anything after midnight the night before because she was having IV sedation. When you get intubated, or if there's any kind of breathing apparatus, you don't want to have a whole stomach full of food because you can aspirate that and have a pneumonia, and that can be really bad. We start the day off with photos, with consents. We spend a lot of time measuring. So the measurements are super important because I want to first mark and measure where the radix is, or the area between the eyebrows right above the nose, where that area is starting, and then what's the distance from there to their existing hairline, and then based off of that distance I then figure out what does 2 centimeters look like, at what point would they be happy, and then we also look at the sides and where do we have to go to the side so that when you bring the hairline down it still looks pretty continuous with the temple areas. The scalp mobility it is an important feature, and you can judge it by kind of doing this and seeing like how much give there is, just to get a sense in advance if you think that what you've drawn out is feasible based on the mobility of the scalp. Now, in terms of the ideal location of the hairline, how do you decide? How do you tell somebody what would be the ideal for them? I think it's much more complex. Well, it's just different than just giving numbers. I don't like just saying, okay, it has to be 6 centimeters, it has to be 8 centimeters based on some sort of textbook answer. What's better is to actually look at the shape of their scalp and as it's going into the forehead. And what I like to do is to see where the vertical of the forehead is lining up with the horizontal of the top of the head, and where those two are meeting is you triangulate it, and approximately in that region is where you want the hairline to ideally fall. Now, intraoperatively, the patient was intubated with a LMA, so this is a type of tubing that sits above the vocal cords. We then used local anesthesia. I use 2 different things. I use a 1% lidocaine with 1 to 100,000 epinephrine as my kind of initial starting type of injection, and then I also use a tumescent solution, which is basically diluted lidocaine, or in my case it's Marcaine, where it's a long-lasting anesthesia and it's more diluted, and it also has a compound in it called tranexamic acid. And I actually wrote a paper, we'll flash it here, with Mike Nyack in St. Louis when I was a fellow, and we were basically talking about the utility of TXA, which is what we call tranexamic acid, in the plastic surgery world, and trying to reduce bruising and bleeding because it helps cause more coagulation of blood. In this particular case, I was very lucky in that there was very little bleeding. As you'll see, we probably could post this to YouTube Uncensored, even though we'd probably get in trouble, but there really was very little bleeding overall compared to sometimes how these SHA surgeries go. So overall, very little bleeding, and I think the TXA just worked extremely well in this patient. Methylene blue is something that I use to mark out the surgical markings, and I basically will do that for my lip lifts, as you guys know, but I also like to do it for the SHA surgeries and certain other surgeries. If your marker gets rubbed off by the time you're actually ready to cut out the final skin and close the incision, you at least have your methylene blue ink stains, and because the ink goes into the dermis, so I do it with a needle once the patient is numb, and I really like it for just kind of as a belt and sort of suspenders type of approach. Then we go on to prep the patient with betadine solution so everything is sterile, and we drape the patient out. Also for sterility, we do a timeout, the usual surgical stuff. When it comes to making the incision is done in a beveled type of fashion. So normally when we make incisions, you go, so if this is the skin surface, we're going to go perpendicular to the skin. But with SHA, because of the hair in that vicinity, we're actually going to bevel it. So we're going to, instead of going this way down with our blade, we're going to bevel it and go this way. And that's going to allow ultimately the hair at the hairline to grow through the scar. Okay, and that's the whole purpose of it. Does it always work out that way? No, but that is the intent, and usually you do get that effect. Next, after you made your incision, we go down and we develop a flap in the subgaleal plane. So there's a layer called the galea. It is on top of what's called the periosteum or the pericranium. So there's the bone of the head. There's a thin layer called the pericranium on top of it, and then we're right on top of that. And there's a pretty nice glide plane there where you can separate it, and it's a combination of sharp and blunt dissection to get pretty far back. Usually I'm going to just over the curve of the scalp from the front. And once we have done all of that elevation, then we put some clamps on the scalp and we apply tension, gradual tension, to create something called mechanical creep. And that's kind of a stretching of the tissue so that they relax a bit to allow it to come down further. So now we know that our flap was able to reach the endpoint, right? The lower marking of where we were trying to go with her hairline. So once we had that, then I had to create landing areas for our endotyne. And the endotyne is this dissolvable type of material made out of PDS, like the same thing as a PDS suture that we use often in surgery. So this is made into like a plasticky type of material that dissolves, and it has these little tiny prongs, and it has a little ball as well. So that little ball, we put it into the bone of the skull, 2 of them, and that allows when the scalp comes down, it holds on to these little prongs, okay? So I needed to create a landing area for those. Then I go into the lower flap, which is now on the forehead, and I do what's called undermining, trying to relax it a little bit. You don't want to go too low, because now you're doing like brow lifting for a patient, so you don't want to do that. And then it's time to put in these endotynes, right? So with the endotynes, you want to make sure you select an area that's away from the center. You don't want to be right along the center, because there's a sagittal sinus running along the center deep to the bone. So we are actually going to be drilling with a manual drill into the bone, not right into the brain, right? Because we have a stopper. There's a built-in stopper on the tip of this endotyne that you're seeing here, and I'm turning it. It's not connected to power, so it's not just gonna fall in, but I'm turning it. It'll stop when it reaches to a 4 millimeter depth, and we know that's not deep enough to reach any important structures, right? So you're just getting through the outer cortex of the cranium. We always have bone wax just in case you reach some sort of blood vessel within the bone and you need to stop that bleeding. So that's the story of the endotyne, and first creating that little drill hole. Then we take the actual material, this endotyne type of device, and we insert it carefully into that hole. So now we're able to take the scalp and secure the flap onto these prongs of the endotynes. That's the purpose of them. And again, they will dissolve over the course of about 6 to 9 months. Once we have that secured down, we can then remove the excess forehead skin, right? So we start in the center and we work our way towards the sides laterally. One side first, then the other side. And as I go from the center out, I'm using sutures. So I'm cutting some skin away, and then I'm using sutures to secure everything together. And I'm trying to limit the amount of tension on that closure. So I like to use 3/0 Vicryl suture, which is a dissolvable type of material. And once we're done with that type of deep suturing, now we have to suture the skin. So what you see here is I'm suturing the skin with what's called proline suture. Sometimes you can use nylon suture. These are non-dissolvable sutures that get removed at a week, and we close up the sides here with an interrupted type of stitch where we're doing these types of stitches. And then for the center, I'm doing a running stitch going all the way across with one long run, and that's going to help secure this area. And we use different sizes depending on, usually 5/0 size for the center and then 4/0 on the sides. And sometimes, like when you're done with that part, you'll see some areas that might appear almost like puckered up a little bit, and that's okay. There's swelling in the area. It will flatten out over time. Even when they come back at a week, things look a lot more flush, and so that is all good. We'll wash the hair because there's sometimes some bloody material that gets on the hair, and the patient, it's gonna be hard for them to wash it vigorously at home. So we wash the hair for them at the conclusion of the procedure before they're awake, and then we apply the bandage, and it's meant to just hold everything in place, and it stays on for 24 hours. You can see here, patient's going to be telling us about her experience. This is fairly immediately after in the post-op in the recovery area, so you can listen to her here.
Did you feel any pain during the procedure?
None.
No pain, right? How are you feeling right now?
I'm a little disoriented, but every minute that goes by, I'm more alert.
And you're happy that everything is done and over now?
Absolutely.
Okay.
It's not that the thinking was happening, I just woke up.
And then the dressing will get removed after 24 hours, and you can then shower. At that time, there's no rubbing. You don't want to be rubbing. You don't want to be pulling on your head. You have to be very gentle with it, of course, because just had the surgery. The trick is to apply ointment, antibiotic ointment, at least twice a day to the incision lines. Okay, so that's very important. You don't want to let it get dry and crusty, as I always tell my patients. You want to protect the area from the sun, so you don't want to be out there in the sun with a fresh incision for at least the first 6 weeks. And then I tell patients, come back at a week, you know, we're going to remove the sutures, and you just try not to like overexert yourself in that first week. It's very important. So we remove the sutures at a week. We have a video here, I believe, of us doing that, and you can see how she has no crusts, you know, which was amazing. You know, a lot of patients come in, they're still very crusty. This patient took excellent care of her wound, of her incision line. So now the plan is to see her back in about 4 to 6 weeks for a follow-up to make sure she's healing appropriately. We do recommend starting scar gel as early as about 12 days after surgery, and the incision will stay kind of reddish and hyperpigmented for months, so you have to be prepared for that. It's not gonna look like a fine line scar for a while, so it does take time. And if it eventually looks like a fine scar that like is barely perceptible, that's the goal. It doesn't always happen, but that is always our goal. And the earliest time to do a hair transplant, if one is even needed, would be 4 months after the SHA surgery. So that pretty much summarizes this procedure. Of course, different surgeons have different variations, different approaches, but this is a fairly standard way of doing the surgery. This particular surgery went super smooth, probably one of my smoothest, and it was fortunate that we had Andrew here filming and we were able to do the showcase for you guys. But as with any surgery, sometimes there are hiccups or things that don't always exactly go according to plan, and things still usually end up fine, but just realize that it doesn't always go as smooth and nice as in this case. But for this wonderful patient, I was so happy that things went great. And as we get more of her results, like, you know, a month out, 3 months out, we'll be posting those to Instagram at Dr. Dr. Gary NYC. So check out our Instagram. Of course, all of our before and afters are on our website as well, City Facial Plastics. All that stuff is, you know, you guys know where to find that. Subscribe to the channel, turn on notifications, hit that like button, comment below. Thank you guys so much. If you enjoyed this SHA showcase, please make sure to check out our hair transplant video showcases. Click on the card and I will see you there. Thank you so much.